Hello, this is Dr. Emil. I thank you for watching, and in this short video I'm going to explain the positive effects of using the QRS therapy in reducing your heartbeat and reducing your blood pressure. So why does QRS have an almost immediate positive effect in reducing your heartbeat? And why, if you use the QRS more often on a daily basis, are you going to see a steady decline of the blood pressure? Starting with the heartbeat, if you have an elevated heartbeat and you start using the QRS, you're going to see in a matter of minutes that your heartbeat is going to substantially decrease. So for example, if you have elevated heartbeat of like 100, in a matter of minutes it reduces to something like 90 or 85. You can test that for yourself if you have the QRS at home by making a measurement before you do the QRS of your heartbeat. And for example, you use the program basis medium, 8 minutes is more than enough, and you make another measurement and you're going to see this substantial decrease of heartbeat. So why is it like that? How is QRS able to reduce your heartbeat? It mainly has to do that for most of us we have two problems as we get older. Problem number one is that our blood gets sicker. Many red blood cells are stuck inside, they cannot bind with so much oxygen. Your blood is too sick, and the other problem is that our blood vessels, because of stress, calcium deposits, fat deposits are more constricted. So now your heart has to work more harder to push this sick blood through the narrow capillary network. Remember that QRS uses pulsating magnetic fields. Remember that your blood consists of iron. So as soon as you start the QRS, in a matter of minutes, your iron starts to interact with this pulsating magnetic field, and in a matter of minutes your blood becomes much more thinner. Every individual red blood cell starts to bind with oxygen, so you breathe more oxygen. And the other effect is that in relation to your blood vessel network, your endothelial cells, the inner lining of your blood vessels, they start to create more nitric oxide, super important cardiovascular molecule. And the result is that your blood vessels, especially your capillary network, is dilating more, it's getting more wider. So now the combined result is that your heart does not have to work so hard, your blood is more thinner, your capillary network is more open. Now your blood flows more easily, and that is the key reason why your heartbeat goes down. Also, another important reason is because of this effect, your blood starts to flow more faster through your blood vessel network, and thereby your stroke volume is going to improve. So your left ventricle of your heart, which is responsible for contracting and pushing a lot of oxygenated blood into the network, that stroke volume is going to increase. And if you have improved stroke volume, you do not need so much heartbeat to get to the same cardiac output. QRS has a strong positive effect on reducing your blood pressure levels. However, this positive effect you normally are going to see only when you use the QRS regularly, like every day at low intensities. This is similar to the effect that physical exercise has on blood pressure. So what happens exactly with your blood pressure depends on the type of physical exercise, the intensity and the frequency of how often do you do the exercise. So for example, if you're not used to doing physical exercise and now all of a sudden you start with this intensive workout, what is going to happen is that initially your blood pressure is going to rise before later it's going to drop again. Only when you start doing that daily walk, for example, every day, now you're going to see this steady decrease of your blood pressure levels every day. And that's the same with QRS. So use the QRS every day and you are going to see the trend of blood pressure going down. So how exactly does QRS, if you use it every day, result in this steady decrease of blood pressure? It does this mainly by reduced vascular resistance and by improved function of your kidneys. In relation to vascular resistance, remember the main formula: blood pressure is cardiac output times vascular resistance. Assuming cardiac output stays the same, which is defined by heartbeat and stroke volume, if you're going to reduce vascular resistance, you're also going to reduce blood pressure. So if you lie on the QRS, as I explained earlier in this video, it results in this thinning of this blood, and also it results in less constriction of your blood vessels. Your blood vessels dilate, they open up a little bit more because your body starts to create more nitric oxide. Also, proven positive effect of QRS if you use it regularly is that your blood vessels are going to be cleaned up from excess calcium and other deposits, so this also helps in reducing vascular resistance. In relation to kidney function, please note that there's various videos on this channel in which I stress and explain that QRS has a strong positive effect in improving your kidney function. So with improved kidney function, also thereby you get this less constriction of your blood vessels, and also your kidneys are going to be more effective now in removing excess sodium, salt from your body, and also removing excess fluids. And now with less fluids in your body, also your blood volume goes lower, and lower blood volume normally results in lower blood pressure. At the end of this video, one additional more specific note: if you are suffering from cardiac insufficiency, so your cardiac output is lower than what it should be, then maybe you are not going to see 1, 2, 3 this fantastic benefit of QRS in reducing heartbeat and blood pressure, because in that situation QRS is also helping you with improving that cardiac output, and it does this mainly by increasing your stroke volume, and also sometimes by increasing your heartbeat. This is the end of this video. I thank you for watching. If you liked this video, you can always click on the like button, but more importantly, if you or someone in your family is suffering from diabetes or heart disease, then please subscribe to this channel, because on this channel you will find many more videos in which I explain the many proven health benefits of using the QRS therapy and some other therapies. Proven benefits, for example, improving your function of your heart. QRS is not just a pain management tool, it is not just helping you reduce blood pressure and heartbeat, it is much more essential than that. So I hope you subscribe, and I hope to see you in the next video. Thank you.